Washing my hands. Hello there. My name is Jamie. I'll be your nurse today. How you feeling?
I'm fine. How are you?
I'm doing well, thank you. Everything going okay?
Yes.
Okay. Well, I just came in because I'm going to do a full neurological assessment on you.
Okay.
I would try and explain it right now, but we'll just go through it together, and we'll go ahead and get started. Can you tell me your first and last name and your date of birth?
Erin White, 6/24/1993.
Do you know what day it is today?
Monday.
And what the month is?
August 29th.
And who the president is?
Biden.
Okay, good. So the first thing that I'm going to do is just to kind of test your cognition. Obviously, we're having a conversation together, so I don't hear any kind of speech deficits. Have you had any trouble swallowing or anything like that lately?
No.
Any past medical history of strokes or anything like that?
No.
No? Okay. So the first thing I'm going to have you do is read these words for me out loud.
Mama, TikTok 50/50, thanks, Huckleberry baseball player.
Good. Read those sentences.
You know how, down to earth, I got home from work. Near the table in the dining room, they heard him speak on the radio last night.
Good. All right. What's this here?
A glove.
What's that?
Feather.
How about that?
Hammock.
How about that?
Cactus.
That?
Key.
And that.
Chair.
Very good. So your speech is all there. Everything sounds good there. No dysarthria or anything like that. The next thing I'm going to do is test your sensation. So what I'm going to do, you can relax for me. I'm just going to have you close your eyes, okay? And you tell me which side of your face that I touch, okay?
Left. Right. Both.
Everything feel the same?
Yes.
No indifferences?
Mm-hmm.
Okay, same thing with the arms.
Right. Left. Right.
Anything different there?
No.
Everything the same? Okay, now your legs.
Both. Right. Left. Right.
Good. Everything the same there? No indifferences there?
No.
Okay, good. Next thing I'm going to do is test your gross and fine motor skills. So this might seem a little odd, but what I'm going to have you do is pat your knees, and then you're going to switch, and then pat, and then switch back, pat, and then cross hands. Ready? 10 seconds. Good. So gross motor skills are there. Now what I'm going to have you do is touch each finger to your thumb. Good, and back again. And again. And back again. Good. So your fine motor skills are there as well. Next thing I'm going to have you do is I'm going to have you cover up one eye. You're going to touch your nose with your pointer finger and then touch my finger. Good. Touch your nose and my finger. Touch your nose and my finger. Nose and my finger. Good. Switch sides. Same thing. Touch your nose and my finger. Back. Good. Back. Good. Back. Very good. So no ataxia in your arms. That's what I'm assessing for. I'm going to check and see if there's any ataxia in your legs. So what you're going to do is you're going to hold your right leg out kind of. Yep. And then you're going to take your left heel and go down to your foot and then ride it up your shin. Good. And back down and up again. Oh, you're switching sides. I didn't even ask that, and you're already doing that. Good. So no limb ataxia in the legs noticed as well. Next thing I'm going to do is a Romber test, which is going to assess your balance. So I'm going to have you stand for me. And what you're going to do is just look forward. Do you feel off balance or dizzy? No? Okay. Now I'm going to have you close your eyes. You can go ahead and hold your arms out to the side. You can put your arms down and you can open your eyes. Good. So no kind of off balance. Before you sit, all I'm going to have you do is just I want to assess your gait. So we can walk forward. Good. And you can walk back. Good. So no balance issues there with your gait. I'll pull your seat back for you. There you go. So that looked good. Next thing that I'm going to do is just check your cortical sensory skills. So the first thing I'm going to do is just have you close your eyes. I'm going to place an object in your hand, and you're going to try and tell me what it is.
It dies.
Yep. So that was good there. That's called the stereogenesis test. The next thing that I'm gonna do is test your if there's any 2-point discrimination. So I'm gonna have you hold out your hands. You can keep your eyes open for now. So this is a 1, and this is a 2.
Okay.
Can you feel a difference there?
Yeah.
Okay, I'm gonna have you close your eyes, and you tell me 1 or 2.
1. 1. 2. 1. 1. 1. 2.
Good. So no 2-point discrimination there. All right, I'm gonna have you hold out your hands, close your eyes. I'm gonna draw a number in your hand, and you tell me what number it is.
10.
Yep. Other hand. Want me to go again?
2.
Yep.
Okay.
Very good. Next thing I'm gonna have you do is just close your eyes. I'm gonna touch different parts of your body, and I want with your right hand for you to point and tell me where I touched, okay?
Okay. Shoulder.
Good.
Wrist. Knee. Forehead. Knee. Chest.
All right, so now that that's complete, what I want to do now is check your reflexes. There's a couple different ones that I'm going to check. The first one is your bicep reflex. So what I'm going to do is just place my thumb here, tap my thumb. You don't have to do anything, you just keep this kind of relaxed. Should be using like a mallet almost, a rubber thing, and what I'm looking for is the flexion in your bicep, which I'm seeing, the contraction of your bicep. Try this side now. So not so much looking at the movement, just at the bicep contraction there. The next one I'm gonna assess is your brachialis radial, which is gonna be right here. So you just kind of relax your hand, and I'm just gonna tap here on your wrist. All right, that side's intact. And that side as well. Okay, the next one I'm gonna do is the patellar. So I'm gonna have you kind of sit back to where your feet are dangling. You just gonna tap right here. Good. And the other side. Good. Both patellar reflexes are intact. The next one I'm gonna test is your ankle conus. So I'm gonna hold right here. And what I'm gonna do is just tap back here at your Achilles, and I should feel some kind of flexion on your foot here. Good. Good. Intact there. Good. You feel it kind of force down. Very good. All right, so now that that's through, what I'm gonna do now is test all 12 of your cranial nerves. The first one is gonna be your olfactory nerve.
Okay.
So I'm gonna have you close your eyes. I've got something here. I just want you to tell me what you can smell. Okay, you can go ahead.
Cinnamon.
Yes. So your olfactory nerve is intact. Next one is your optic nerve. What we're gonna do is the Snellen test. It's the chart with all the numbers. So I'm just gonna have you look forward. I'm gonna have you cover your right eye. You should be at about 15 feet with a chart on the wall, but since we don't have it, I'll just use this. Can you read the 4th line there?
LPED.
How about the 6th line?
EDFCZP.
How about the 7th line here?
FELOPZD.
Do you think you can read the line below that?
DEFPOTEC.
Good. We'll check the other eye. We'll go 4th line.
LPED
6th line.
EDFCZP
Good. We'll go 7th line there.
FELOPDZD
Say it again.
FELOPZD
And the 8th line.
DEFPOTEC.
Very good. So no kind of visual issues there. The next one that I'm going to check is your ocular motor. So what you're going to do is just kind of follow my finger. You're just going to see the range of motion in your eyes there. So just follow my finger. We'll go down. Good. And back up. Good. To the right. Good. Back to the left. Good. So now what I'm going to do is test your tracheal nerve. So what you're going to do is you're going to look up for me. Good. Look all the way down as far as you can. Good. Bring your head back to midline. Look to the right. Good. Look to the left. Good. And that's good there. The next one I'm going to do is your abducens nerve. So what you're going to do, I'm going to turn on the light here. And I'm also going to assess your trigeminal nerve as well while we do this. So what I'm going to have you do is just look forward. I'm just going to see your pupil reaction there. I can see that they're both equal. Good, good contraction. Same on that side. Okay, just keep looking forward. Good. You gotta keep your eyes open. Very good. Okay. Now what I'm gonna have you do, this is gonna be testing your, again, the abducens. You're gonna look forward, touch your nose, finger, back to your nose. Good. Back to your nose. Up. Good. And down. Good. So, next thing I'm going to test are your facial nerves. I'm just going to have you do a big smile for me. Bigger. Show me teeth. Good. Close your eyes real tight. Good. Raise your eyebrows up. Good. So your facial nerve is intact there. Next thing I'm going to do is test your acoustic nerve. So I'm going to whisper, I'm going to close one ear and whisper something in the other ear, and you can try and tell me what I say, okay?
Bluefish.
Yep. And the other side. Did you hear me?
Nope.
Okay. Do you have some issues with the right ear?
Yes.
Yeah, some hearing issues?
Hearing loss issues.
Okay. Is that something that happened in the environment, or?
I was born like this.
Oh, okay. All right. Is there a hearing aid that you can get for that, or no?
No.
No. Just permanent damage, huh?
Nerve damage, I was told.
Gotcha. All right, so the next nerve I'm going to test is your gastropharyngeal, or your glossopharyngeal, sorry. So I'm going to have you just open up. Say, I'm going to have a tongue depressor here. Good, your uvula goes down. I want you to try and push up on your tongue. Good. Now I'm going to check your gag reflex. So open up. Should feel some discomfort. Yeah.
Thank you.
So I'm going to check your vagus nerve, and that's going to tell me if your swallowing is good. So just look forward, just swallow for me. Good. See that up and down movement, so your vagus nerve is intact. Next thing I'm going to have you do is check your accessory nerve, which is what controls your head movement. So I'm going to have you look down for me and back up. Good. Side to side. Good. Shrug your shoulders for me. Good. Any pain there? Any kind of resistance? No. And then I'm going to have you stick your tongue out, move it to the right side, left side, up and down. Any resistance there?
No.
No. And that was your hypoglossal nerve, and that is intact. So all your nerves are intact. You got some hearing issues that we can talk about and go forward from there. But other than that, I'm all done with my assessment.
Okay.
Thank you for your compliance, and I'll be back in shortly.
Alrighty.